Yes, I can hear you, Lisa. I had the poor connection sign. Okay. So, is your mouth a window to your health? This was an absolutely fascinating topic, researching into this and learning about this. And I have been reading quite a few bits on this for a while, but just taking a little deep dive, just amazing the amount of information that can be gained about your body just through your health. And it's something that many people, when they think about oral health, they kind of disregard it and see it as like a totally separate entity when it comes to nutrition. People think, right, okay, I brushed my teeth, I've flossed, and they're like the two pillars of oral health. That's enough for me. So there's a famous research into oral health and like a natural and holistic approach taken by Dr. Weston Price. And just amazing, how he was able to, and he's actually a dentist himself. And he was actually able to, join the dots and show that there is a huge relationship, in fact, between oral health and your diet. And what he did is he had his own practice. He had his own patients, but he went to traditional cultures and he visited them. This was around, I would say, 1930s, I believe. He looked at their practices and their diet, and he was just amazed, with the findings, because those traditional cultures didn't really have those brushing and flossing, dental hygiene habits like the people in his practice, the people in the West. They didn't really do that at all. But their teeth were perfectly straight, free of decay, correctly formed in terms of their jaws, and they didn't have any cavities. And he just really couldn't understand that. He thought, what's their secret? What is their oral health showing? How was it different? and he noticed it was because of their diet. So, if your mouth is full of cavities, you have a poorly formed jaw structure, have you actually considered that there's a connection to your diet? These traditional cultures, what they were, their diet was found to be rich in minerals, and especially fat-soluble vitamins like vitamins A, D, and K. And they were actually devoid of processed foods. And they had this comparison between the communities when they did start introducing processed food and what actually happened to their teeth. And yeah, they did decay. They did start to have poorly formed jaws and this kind of thing. Because, people today, when they think about teeth, they're looking at white teeth, that their breath is pleasant smelling. And, those are the benchmarks of optimal health. But your oral health is actually an indicator of your overall health. Okay? So, I mean, that's something that's really, really important to consider. And with Dr. Price and his patients. Okay, so his patients, they actually ate refined white sugar, refined white flour. This is what they mainly, their diet was, the main components: canned condensed milk, canned foods, vegetable oils, and low fat and skimmed milk. Okay, so that was their diet, right? The diet of the traditional cultures was quite different. They consumed one thing that was they obviously didn't have all those processed things in their diet, but one thing that was markedly different was their consumption of organ meats. Okay, now this had like a twofold kind of benefit. One was obviously the vitamins and the minerals, and the benefit for their own body in terms of having those organ meats, but also, which is really important, was the structure of their jaw. So not only did his patients have tooth decay, crooked teeth, narrow jaws, narrow palates, they had overcrowding in their mouths with their teeth, they had underbites, overbites, narrow faces. This was all, related to their diet. And those that ate the traditional, from the traditional cultures, they didn't have those issues. They, in comparison, had robust immunity. They had healthy digestive systems, wide bones. They were strong, hardy. The children, and their teeth were free of decay, straight. They had wide jaws, wide palates. They had space for all their teeth. There wasn't any overbite or underbite, and they had round faces. Okay, so I mean, this was absolutely amazing, for him to notice that and to note it down. And I don't know, for any of you who have children, and if you've started to notice this, because it's actually quite a common thing, and I've seen it myself, and even with one of my daughters, what tends to happen is in late childhood, as the milk teeth are fallen, and the adult teeth are starting to erupt, they start to have crowded, crooked teeth. Okay, so if your child has that, what is that telling you? What should that be, giving you an indication of? Okay, so I mean, like, if we went to traditional dentists, they had a look at it. It's probably quite normal for them now. And obviously, the first thing that they mention is, okay, get braces. That's going to straighten your teeth out. It's going to spread your palate a bit, and it will house all the adult teeth in them. Okay. But what which is something that I didn't even totally consider, that this modern debilitating, oral health trend was actually pointing to something else. And that was the underdevelopment of the jawbone. Now, when you have that can cause a whole array of difficulties and issues with not just your teeth, not just having overcrowding, because your mouth is connected to so many things. And this topic is just so deep. I think we're going to have probably a couple of sessions on it, because in terms of posture, in terms of your tongue, in terms of breathing, sleep issues, so many things can occur as a result of what's going on in your mouth. And the roof of your mouth is actually the floor of your nasal sinuses. Yeah, so if you think about it, the top of your mouth is just, your nose is under that, and that's the floor of it. So when it's narrow, when you don't have that wide palate, that significantly reduces the volume that you have to breathe through. So if you have a child who has this issue and they're snoring, that's problematic. It's not funny, that we think, oh yeah, such and such snores, and that's hilarious. But no, that's actually one of a sign to indicate that they are suffocating in their sleep. Yeah, crooked teeth. Human teeth are not designed to grow crooked. That's not the norm. Despite what we see today, that is not the norm. Okay, so if you're having that issue, so now because we want to stick to our title, what is that indicating? What is it showing? If the upper teeth are jutting out over the lower ones, your lower teeth are crooked, where you see some children, it just looks like they've got so many teeth in their mouth, there's not enough space to fit them all. The issue is not the teeth, but the jaw itself. Okay. And one actual solution to this problem that was noticed was actually chewing. That we don't tend to chew our food that frequently. And if you think about what you're actually eating on a day-to-day basis, it's not really anything that you have to struggle with. And again, this went back to organ meats and how those traditional cultures would eat a lot of them. And, if you've ever had liver or kidneys or lungs, or, they're not really that easy to just kind of, put in your mouth and it melts in your mouth. No, you really have to use your teeth and your jaw. And that's really, really important, especially in children. And, at the time when their whole mouth and their jawline and their teeth are developing. And this was actually studied by dental anthropologists. They found that rural populations tend to have better jaw structures, largely because of their diet, compared to children who are in the urban setup. So super important. I don't know if anyone else wants to share their insights before I just go on and on with all the benefits I have. Yeah, one thing that just comes to mind whenever I hear anything related to this is, from the Sunnah, how the Prophet sallallahu alaihi wasallam, he just loved the miswak, and how it was recommended to us to use it. And when you read all these papers on oral health, you can it just makes so much sense why, and yeah, those issues with having inflamed gums, that inflammation, yes, it's like a super indication that you're going to have inflammation in your body, for sure. And then obviously that is going to profess itself onto your skin, no doubt about that. And I'm just to refresh the room here. So there's Lisa here and Ruqayya here, and you can click on their names and read their bios and follow them up, and myself on Instagram if that's something that interests you. So the other thing that I wanted to mention, in relation to crooked teeth, which you may notice by the time your child has all their teeth around 3 or 4 years of age, that it actually affects the shape of the face. Okay, so crooked teeth would be a sign that the craniofacial system hasn't developed properly. Okay, and this isn't how the human form should be designed. Okay, an inadequate development of the jaw is not how we were created, to be. Narrow jaws, they bring a whole host of symptoms, because when the jaw doesn't form properly, right? Why is that a problem? And this is all in your mouth, and you can see this easily. If you ask a child to open their mouth, and it's not a wide U shape, instead you've got like a V kind of shape. This is a jaw that hasn't been a narrow jaw, so it hasn't formed correctly. And when you have that, what you would find is that the teeth just simply don't fit. Okay, an optimal jaw would be accompanied by a wide palate. Okay, so you will see that when you ask your child to open their mouth, or you open your own mouth, you can see that. And that will be the single indicator, and it will dictate whether all adult teeth will fit or not. Okay, so this whole thing about jaw and teeth alignment, which you can see straight away from someone, what happens is that it affects breathing. It affects the correct nasal breathing, which is more important than breathing from your mouth. Okay, so when you're not nasal breathing, which is just essential, because then if you're not breathing properly, you're not getting enough oxygen to your vital organs. So to have proper jaw and teeth development, that is what it affects. Okay, and some signs that you can look out for that the nasal airway is obstructed could be things like snoring, mouth breathing, and also gasping during sleep. Those would be clues that that is constricted. Okay, so other things that you might notice on a child would be something like dark circles under the eyes, when they like maybe just sitting there reading or watching something, their mouth would be open, instead of closed, and the correct position would be for the tongue to be on the palate, and breathing from their nose. And they tend to have a rounded jawline. Okay, now if you have those things, if you see those things in the child, you can have a look into their mouth, and it might be quite highly likely for them to have crooked teeth and a narrow palate. Okay, so an optimal facial shape would usually have well-defined cheeks. Their mouth would be closed during rest or sitting, and a square kind of jaw angle. Okay, so I mean, like I said, there's so many angles that this topic can be explored. It really is going to require another session for sure. But one of the most fascinating things that I kind of stumbled upon a while back, and it's obviously something that hit home because, like I said, I noticed it in one of my children. You know, was the teeth overcrowding the mouth, and not just that, the milk teeth not falling out. Now, when we saw this on our daughter, we didn't really know what to do. We just assumed, okay, you know, maybe it's a good thing, you know, it shows her milk teeth are strong. But then as time went on and the adult teeth started to erupt, and now you're seeing them pushing out under the gum, and that milk teeth isn't moving. It's not even wobbling, it's not even loose. Now we had to go to the dentist, and obviously they make all kinds of suggestions about braces and this kind of thing, and then they also suggested extraction. Now we were at a point of thinking, well, we have to do something because these adult teeth are coming out, and it just looks wrong. You know, it doesn't look right at all for her to have both her baby teeth and her adult teeth in her mouth. But you know, this issue is quite common with children today. And there's a holistic dentist by the name of Dr. Stephen Lin, and he's got some really good work on this. And he mentioned that this issue is actually a warning sign because it's a good marker for thyroid issues. Okay, so you know, this problem of the milk teeth not falling out, even though the adult teeth have erupted, that is a marker for that. And you'll also find with these children and them having the slow loss of their milk teeth, or even like loosening, you know, sometimes it might take months, years for that to happen, which was the case with our daughter. And then adult teeth start to erupt behind or in front of the gum. And sometimes it never falls out, which is what happened to her. And you know, for the sake of helping that dental development along, we had to have some of her teeth extracted, and that, he mentioned, was a marker for hypothyroidism. Okay, so where it's like slow, I believe. So that was associated with delayed dental eruptions. Okay, and other things related to that, what you might find with the child is that they breathe from their mouth. They might also have malformed enamel. The salivary glands will be enlarged, and their tongue will be inflamed and red. Okay, now if there's the opposite kind of situation with that, where the teeth actually falls out faster than usual, and they have you know, the first signs of their adult teeth earlier than you kind of expect, then that usually indicates hyperthyroidism. Okay, so an overactive thyroid. And what you might also see with that child would be like increased dental decay and something called burning mouth syndrome. So like I said, this topic is absolutely fascinating. You know, something that I definitely want to touch on again, especially in terms of, you know, we haven't even gone into like the Chinese medicine, the Chinese medicine approach in terms of like how they look at the tongue and how it, you know, points to things with them, and how, you know, the teeth obviously have loads of nerves on them, and how each of those nerves is connected to a different organ. You know, it's just absolutely amazing. So yeah, you know, I hope that we've been able to give you lots of value today, and you know, information that you can take away and, you know, research further, and something that, you know, you've gained from.